To the extent that FDA makes cybersecurity, at least with respect to safety and effectiveness, part of its pre-market review process, individual providers and hospitals' inability to access information and have sort of all the data at their disposal, that's one of the reasons we have an FDA, right? That's one of the reasons we have a gatekeeper for medical products, because it's actually really, really hard for even expert physicians to know that this particular drug works or this particular device works and this one doesn't. So if it's part of FDA's pre-market review process, that might give hospitals and providers some comfort that they're choosing a product that has appropriate cybersecurity, at least with respect to safety and effectiveness for the patient. Although hospitals and providers have other obligations under HIPAA and other privacy laws that I don't know as much about, but so they have other obligations that FDA may not. So I don't know how hard they should be pushing or how much they should, how good of a use of resources that is for the hospital. I mean, I think part of it depends on what the, what the sort of science and computer science side, how high the risk really is, and how, whether there are meaningful options. I mean, it may just be that there aren't very many differences between devices, in which case, you pick the device that's best for the patient and, mitigate the risk as best you can.